Good afternoon and happy Tuesday. Welcome to Ask Dr. Jeff, the interactive Zoom platform where we discuss all things photobiomodulation and Lifewave. I am Dr. Jeffrey Hubbard, a medical doctor here in the Dallas-Fort Worth Metroplex. I'm your host and facilitator. As always, it is my pleasure and actually exciting for me to share space with you all and discuss this amazing technology. We have been going for a very, very long time, it seems. This is now episode number 74. We took a break last week and now we're back. We celebrated 4th of July holiday by not having Asked Dr. Jeff, but to just relax, and hopefully you guys enjoyed your holiday festivities. Let me just share with you, I went to the fireworks store. We were gonna, experiment with some fireworks. It is much more expensive than I remember when I was a child. I cannot believe I spent that much money on 15 minutes of fun. So I hope your 4th of July holiday was just as exciting as mine, and hope you enjoyed your families. Today, guys, we are going to be, as always, discussing photobiomodulation, the company Lifewave that we all are familiar with. If you're not familiar with it, it's been around since 2004. Its global headquarters is housed in Western Ireland. The closest facility to us here in the continental United States is in San Diego, but there are 15 distribution centers now around the world, specifically designed to help to ensure that these amazing patches reach all ends of the globe. So it is such a wonderful opportunity for each and every one of us to be global ambassadors and brand ambassadors and global distributors of this amazing technology. It works like this. The light that we emit is in the form of near infrared light. It's a part of our body heat that we emit because we go through metabolic processes in all of our cells. They're like little power centers. They're creating energy for themselves to operate and do the things that they need to do. And as a result, our body emits a heat, right? We are mammals and warm-blooded. So this heat actually is in a form of light that we cannot visualize with the human eye. It's a part of the near infrared spectrum. So our visual light spectrum that we can see as human beings is very narrow in comparison to all of the different lights that we have in our world. And so near infrared light is in essence similar to sunlight, all right? So these patches have a proprietary blend of organic materials. You can think of them like liquid nanocrystals, and they are capable of reflecting these near infrared frequencies of light, and they reflect them back into the skin. And so essentially you are bombarding your body with about 40% of sunlight, all right? And so this induces your body to produce certain key molecules that are extremely beneficial. They've been studied and researched. This is not novel to Lifewave. In actuality, Lifewave is harnessing the science community's understanding of how all of these really cool molecules that we're studying work. So here on Ask Dr. Jeff, we primarily talk about X39, which is the most popular patch. It's our show pony, it's our rock star. It is designed to raise a molecule called GHK copper peptide. And this molecule has been studied since the early 1970s by Dr. Lauren Picard, a world-renowned professor at Harvard. And he's been coined the term back the clock doc for all of his work with GHK copper peptide and what he's been able to prove about its capability to help certain genes express themselves more effectively. And so one of the downstream effects of GHK copper peptide is the improvement of our stem cells, the way that they're activated, the way that they are created, and the way that they function. And so the results, guys, are simply phenomenal. You'll hear more about that during the question and answer period. These patches just do awesome things. All you have to do is wear them. They're safe, they're effective, no drugs across the skin barrier. And frankly, the dosage is very easy. It's 12 hours on, 12 hours off. Don't make it complicated. Just peel and stick the patch on and watch the magic happen. All right. So we're going to jump into an article to discuss one of the patches that I feel like is moderately underrated. So let me share with you why I think this particular patch actually should be a part of your repertoire on a consistent basis if you have not already done so. All right. So today's article review, guys, can everybody see that? I hope so. It says anti-cancer actions of carnosine and the restoration of normal cell homeostasis. All right, so let me preface this. So I'm going to do my housekeeping up front, okay? These patches do not heal, treat, cure, or prevent any medical condition. They have not been designated as a type 2 medical device by the Food and Drug Administration. So what we're talking about is the science behind why these patches were created, not that the carnosine patch is somehow anti-cancerous, okay? So what we do here is we review the abstract. For those of you who are joining me for an article review for the first time, we pull up the PDF article. You can find this right on pubmed.gov. It's public information on the National Institutes of Health's biomedical research database. This article was published in October of 2021, and it's from the laboratory of Dr. Mark Turner, Craig Sale, Christopher Garner, and looks like Alan Hipkiss, all right? And this was published in Biochemica, to molecular cell research periodical, okay? So in the essence of time, we're not going to cover the entire article. We're going to discuss the abstract. The abstract is our synopsis. It comes at the beginning of biomedical research articles to help you understand what it's about and what the general findings were and exactly how the research team determined their information, all right? So a little bit of background about carnosine. It is a dipeptide, means it has 2 amino acids, and it's found in meat. All right, those 2 amino acids are beta alanine and L-histidine. Okay, those 2 amino acids come together to form the molecule carnosine. What we find is that carnosine is an antioxidant and it's anti-glycating, which means that it helps to break down free radicals inside the cell, and it helps to break down glucose. All right. It facilitates healthy aging and also has been shown to be involved in anti-proliferative effects that have been beneficial in the development or against the development of several different cancers. All right. Carnosine is able to undertake multiple molecular processes, and its mechanism of action therefore remains controversial, both in healthy tissue and those associated with the cancer and metabolic disease. So they're reviewing how these different mechanistic roles of carnosine happen in the body and how it's able to prevent certain cancer development, and also how it is stimulating homeostasis or physiological balance, all right? It turns over rapidly, which means it's broken down and created very quickly. And it also can be a dietary supplement. So guys, this was published in last year, but this is not new science. So Mr. Schmidt was reading these articles and he said, carnosine is being talked about as a molecule that helps with anti-aging, right? So if I'm going to make a Y age group, the question is, why should we age? That Y age group includes carnosine, glutathione, and eon. So here's an article. We've already talked extensively about glutathione, and we talked extensively about Eon and how they are capable of preventing the aging process. But we haven't spoken specifically about carnosine's ability to promote anti-aging. But here's a very, very recent article. I mean, we're talking about in the last 8 to 10 months, guys. This information is being published so that the medical community and the research science community can understand that carnosine as a dietary supplement is very beneficial in all of these different ways. Now, imagine if you had a patch that was clinically proven to raise your carnosine level without any supplementation. Would you be interested in that if you knew that this little dipeptide could help you to age gracefully and could help to put your body in the state of being where cancer does not develop? I think that's a really awesome patch to have on board. And guys, to be honest with you, you can stretch your carnosine patches a little bit longer than you can some of the others. We only recommend that you wear carnosine every 3 or so days. You should be wearing your patch about 3 times a week. So there's a really, really good example of what carnosine can do. And carnosine in conjunction with the other Y-age patches are very, very powerful. They definitely have a synergy with each other. And as you saw there in the article, just as recently as 10 months ago, there's still a debate in the research community about exactly how carnosine does what it does. But guess what? It does something amazing. And that is the really interesting element, is that I know, for instance, if you have any sort of indigestion, any sort of acid reflux or anything going on with your stomach and your digestion, carnosine can really make a difference. If you've got something going on with your lungs, if you're a former smoker, if perhaps you're a firefighter and you've had a lot of smoke inhalation, carnosine is amazing to help with your lungs. If you've suffered any brain injury, any damage to the tissue of your brain, if you notice that your cognitive ability is starting to decline, carnosine is a great patch. It's a really great rebuilder. It helps with the cardiovascular system. It helps with the endocrine system. It helps with the nervous system. All right. So that is our lesson for the day. And I made good time. We have plenty of time for question and answer. Guys, just at the bottom of your screen, there's a reaction icon. It looks like a smiley face. You click on that, and then you'll see several different options. You can give a thumbs up. You can raise your hand. You can give an A-OK sign. Please raise your hand. Let me know that you have a particular question that you'd like to ask. And that also creates, a kind of sequence of questions that can be asked. And it also helps me to ensure that I get to everybody in the appropriate order. All right. We're going to dive right in. Mr. King, it's your turn, sir. You can go ahead and unmute yourself and ask your question.
Now, it's not really a question, just want to share an experience quickly.
Sure.
Doc, I've been on the patches for 2 years, and you, as well as Dr. Quila, have helped me appreciate it early on that if we consistent with these patches, it will help your body. Well, last Sunday, I came down with COVID.
Oh, no.
Thought I had like, what's wrong with my throat? Put a glutathione on my throat. And then the next morning it was everywhere. And then of course I took the test and I had COVID. Was pretty bad off. Of course I've had shots and everything, but I was pretty bad off. But 2 days later at night, I sweat profusely that night. And then the next morning, boom, I was back to rocking and rolling. My wife had caught it, whether we gave it to each other, how it came around. And she had been down for like 4 or 5 days. She's not as consistent as I have been in the 2-year period, but she eventually has come back around too. All I'm saying is to say, I shared with her today. She said, well, how do you think you rebounded so fast? I said, well, here's the deal. When we were younger and we caught anything, our bodies were able to battle it. And we did not stay down long, no matter what it is. And we all remember that. Well, what David has done for us is give us a chance with consistency to be able to go back there. And like I told her, I said, you know, I've been consistent with the patching process for 2 years. So that's what happened. I told her I had more copper peptide in my body. And although I had this virus, even though I did, like I said, I did have the shots, it just lends to the consistency of what we need to do with this, because we never know how things are going to go.
Indeed, indeed, indeed. Well, I'll share this with you. One of my team in the Philippines is an internist. So she likely caught COVID from one of her patients, but she was in a similar predicament, wasn't really able to go to work, wasn't able to get out of the bed too much, was coughing. And it was so ironic because she was getting ready to make one of our presentations for Patches and Prayers. It was actually the first symposium that we did. And she was emailing us and saying, hey guys, I don't know if I'm going to be able to make it. I don't want to be coughing through my presentation. And so saw fit that she made it and she was able to make the presentation. And towards the end, as she's discussing all of the benefits of glutathione, and she says, I would not be here today if I didn't have my glutathione patches, because it helped me to recover from COVID faster than anyone else I know. I was only down for 7 days. I was coughing profusely, having all of these symptoms, and glutathione and the patches helped me with all of those symptoms to resolve and help my immune system to fight off the virus. And so I totally hear what you're saying, man. There's been several testimonies about how these patches have just dramatically and dynamically improved people's experience with being sick in so many different ways, but yes, specifically with infection. All right. Barbara, your turn. Go ahead and unmute yourself and ask your question.
So I got on late just as you were finishing about carnosine, and you were saying that you could use it really every 3 days. I actually have been wearing it every night without skipping any nights. Is that the wrong thing to do?
No, not at all. I was saying you could actually, if you're relatively healthy, or if there's not something in particular that you're trying to accomplish with carnosine, once you get your levels of carnosine up to what we call a therapeutic level, you don't necessarily have to wear it every day. But there obviously is a lot of benefit to wearing it every day. I was just suggesting that the pamphlet of information from Lifewave says that you wear it about 3 times a week.
Okay.
So
perfect.
No, you're in good shape. And if your body is telling you wear carnosine, I would listen to it.
Okay, great. Thank you.
No problem. No problem. All right, Nancy, your turn. Unmute yourself and ask your question.
Oh, hi there. I guess it's the carnosine. I have a question about the placement. Okay. I know there's 4 or 5 different placements in the pamphlet.
Yes, ma'am.
Because I have issues with back from time to time, I put mine on the base of the spine. In one of the pictures, that's where they say to place it. Mm-hmm. But what if you were concerned? I'm personally just having problems. Like somebody asked me what my doctor's name was for my urinary issues. I couldn't remember. I said, just forget it. It'll come back, but it'll be tomorrow. Or so those kind of things are happening to me. I don't think I have actual problems, but where would you wear it? Specifically, can you think of where a better place to wear it would be for cognitive? Since that seems to be a problem that I'm looking at, so why not?
Well, so just a quick caveat. I personally have really vivid lucid dreams when I wear carnosine at night, specifically in and around my face and head area. So if that's not a big deal, go right ahead. But that would be here on the forehead, at the third eye. When you wear the hat protocol, you wear it at the crown. But I don't, you have hair just like I do. So maybe get a hair clip and kind of clip it in there right at the top of the crown.
Okay.
The back of the neck is great. all of those three would probably be good places to go ahead and try for the cognitive, the rebuilding of brain tissue, the rebuilding of nervous tissue. That would be the go-to for me. And while I have you, I was thinking about your hip related stuff. And I think wearing a glutathione and an eon stacked about mid-thigh on the iliotibial tract on the outside, like we talked about, and then wear the ice wave up on the hip joint itself. You're going to wear the white in the front and the tan in the back. And so
actual front and back.
Yes.
You know,
Yes.
Okay.
So, well, in the front of the hip, front of the hip joint, and kind of the tan patch will be around towards the buttock on the back of the joint, kind of on the hip. But, without you telling me exactly where your aches and pains are in there, just kind of orient them so that the pain is right in the middle.
Okay, and which was the dark on the front?
The tan goes in the back.
Oh, in the back.
Mm-hmm.
Yeah, because it feels like it's around the joint at times, because when I stand up, that's where the pain is.
Mm-hmm.
It's around the hip. It feels
Okay.
muscular, but I don't know what hip pain looks like. I don't know. I've never had hip pain.
Okay.
Thank God so far. So
Yeah.
I don't know if it's the hip or the muscles, but anytime I take the first step, I feel it kind of around the bottom of the hip, I guess. And in that area, it could even be higher. It's sort of a broad pain barrier or pain. It's hard to explain, but it's not very specific. It's sort of like the whole thing hurts.
Yeah. So try that and see if that gives you some relief. It should look like a big pointy triangle, pointing down the outside of your leg. So try that. Also X39 would be helpful right on the hip. I know a lot of people have seen a lot of improvement in their range of motion and their ability to, to deal with hip pain and hip discomfort by putting the X39 there. So you can try X39 overnight and then wear that glutathione eon ice wave combination during the day.
Okay, thank you. We'll give it a shot.
All right, wonderful.
Thank you.
Okay, guys. Let's see, nobody else has their hand up. Any other questions? I did see one question in the chat. Let me make sure okay, I think we got that answered. So guys, again, the Y age group, glutathione, eon, carnosine. All right. So we talked about carnosine today extensively with the article, but all three of those patches are just really dynamic. And they all came out at the same time because David asked the question, why should we age? Why age? So that group all have antioxidant properties. They all have different benefits. They all have, different ways in which they help the body to be in a better state of being for healthiness. So they're almost interchangeable if you want to consider it that way, but they each one have their pros and their subtle nuances. All right. But, you may be asking the question, well, what's the difference between glutathione and carnosine here, or here? Not much really in the way in which your body responds, right? They're both going to help clean out the cells. They're both going to make sure the cells are functioning properly and doing their job properly. They're going to help to eliminate unhealthy things from the body, but then you have subtleties that are specific. I've seen carnosine help with digestion related issues, but I think carnosine does it better. I've seen eon help with, facial pain, headaches, trauma, but could glutathione do the same thing? Could carnosine do the same thing? Absolutely. But, so that's why sometimes it's beneficial to stack them. I've even heard of people stacking all three together and using them all in a triplet combination. So it just really depends upon what you would like to do and how you'd like to do it and what you're trying to accomplish. Okay. Let's see. Do we have any other questions? Did that spark any interest? Do we have anything else to discuss?
Sorry, I'm not muted. I thought the iPhone person said something.
In the chat, maybe? Okay, wait, we got a couple hands raised now. Oh, wait, Barb, you have another question?
Yes, I do.
Okay.
What you just said about stacking, is stacking preferable to like making a triangle? Because I know the triangle is also a powerful way to use 3 patches.
Yes. I don't know if it is how would I say more advantageous than the triangle. In the instance of what I just shared with Nancy, she's having some hip pain, and I'm suggesting to stack the glutathione and eon, but not stack the ice wave. So the ice wave would be on its own, but there would be a stacking of glutathione and eon. Just because I think there might be, Nancy's very active and she's an exerciser and she's a walker. So I think at some point, maybe there's a slight pull or strain or sprain of some of the soft tissue in the hip. And that just can be extremely painful because you use your hip every time you get up, do anything, walk anywhere, sit down. So it's kind of like the ribs. It sucks when you have an injury to that area because it never lets up until it gets better.
Sure. Thank you.
So yeah, just kind of a combination, or depending upon the protocol. I've been reading a lot more about different types of protocols that people have used in the past, and stacking one patch or another on top of an energy enhancer or on top of ice wave is another method as well, but I'm not as familiar with how that works. So I'm not ready to recommend that just yet. So as soon as I get my head properly wrapped around it, we'll talk about that some more. Okay. All right. Jerry, welcome. Did you have a question? Go ahead and unmute yourself.
Yes, I do. My question's for my dad.
Okay.
He's 95 years old. He's been on the patches since end of October.
Okay.
They've helped him in a lot of ways. But one thing I can't get my hand on helping him with is the back pain. And the back pain, he doesn't have it like all the time, like you have a pain and you can go patch it and see if something works. If he's bent over making his food, or if he's walking too long, he gets a pain that starts, he thinks, around in the hips, and then it just radiates through his back, up through the hips and the body and the back. And then it comes to a point where he can't walk anymore. And I've tried everything. I've used the triangular approach. I've used the 39s, the 49s, the eons in a triangle. I've used the ice waves on the feet. I've used the energy enhancers. I've tried the eons with it. I've just tried everything. What I do is I have a calendar, and each little block, every day I put something in it to try to help him. And he has had some days when he hasn't had any pain, and he feels really, really good. And at 95, I'm surprised that he did have all the help he's having. I mean, it's just amazing, everything that has helped, but we can't get the back pain to subside. And lately it's been lingering, but if he's sitting around, he's fine. And the restoration point, recovery, is really quick. I mean, he'll sit down and 5 minutes later, he's ready to go again.
Interesting. And has never had any injuries to his back, nothing specific to speak of, and it goes up, not down.
I'm sorry?
The pain starts in the buttock and goes up, not down.
Right. It goes up.
I mean, typically when you think like acute back pain like that, like I'm walking somewhere or I'm reaching or bending or twisting or doing something like that, and then there's a shift from I wasn't having much of any pain at all, and now I need to sit down because I'm in excruciating pain. typically that's like an immune response. That's like an inflammation. That's like something coming to the nerve, something getting to the nerve, or a shift in his vertebral column, right? If the disc is low and he's doing something strenuous and it shifts the disc out of place, then it's pressing right on that nerve. So, I mean, there's quite a few different back protocols. But maybe I think it just maybe some preparation for that. Does he wear a back brace? Does he use arnica?
No.
Okay.
No.
So those are a couple of things, that probably make some sense, is to get a back brace for him, not something crazy, but just the kind you wrap around and kind of support your muscles and support your spine. So that if he's going to be doing any walking, lifting, things that, typically trigger that, then he's got some support. And then there's a liquid called arnica, and it's like an extract from a plant. And it just is very powerful with any sort of inflammation, any sort of joint pain, any sort of challenges like that. Most people use it when they're athletes, like for knees and ankles and things like that. That's another good strategy. But I think for the back, specifically with the patches, I really think you have to find the sweet spot with Icewave. And Icewave is kind of tricky. The clock method is one way to do that, but that doesn't always work. And so then you shift the tan patch from the inside where the pain is, and you put the white patch there, and then you try the clock method there. But also I realized that there's certain other acupuncture locations, like here, right in the webbing of the thumb. This is large intestine 4. You can put one of the Icewave patches there and one on the back. You can put one right in the center of the chest, right here on the breastbone, like pretty much where the nipple line is. So here's my nipples, and boom, right in the center of the chest, you can place either the white or the tan patch there, and then put one on the low back where he's having the pain. Those two have been very effective. Is there any pattern to it other than he's doing something strenuous?
No, he's not doing anything strenuous. That's the weird thing. And it's like I said, I'm in Florida and he's in Pennsylvania. So
Okay.
It's even harder.
Even
And
more
trying to patch his back is even harder. And
Sure.
I've stacked them, and I said, okay, put the Eon on the Icewave and then put it in. We've done different things like that. But it's really weird. He can be bent over just a little bit, making his breakfast or doing whatever it is he's doing over the counter. And then all of a sudden it starts. A lot of times he can be doing something that's not really hurting. When he was having good days at his age, you kind of wonder, well, he lost something in a car. And he was out there and he was on the ground and underneath it and everything. And later on, he's telling me everything he did. And I said, well, what about your back? He says, it didn't hurt. But the thing is, it's been hurting a lot more now. And it's this pain when, he's bent over in a position, it seems. So, but I'll try what you just said with the webbing of the hand and that. And with him, I've been trying to tell him on the back, but he can't do it. And and he's 95, so he's doing the best he can.
Impressive that he's living on his own, so nobody to help.
No, right now my brother's visiting, so he could help him right now.
Okay, well, that'll be great, because sometimes it's hard to get it in place on the back and get the seal so that it doesn't come off and all of that. So if your brother can help, then that'll be great.
Yeah, and see, like he gets up and he puts his patches on that I give him for the day, and he's fine with where they are. But if I was there and it was actually hurting, and that's when you can do it. But it's not that kind of a pain. It's not a pain that hurts.
Right. You have to catch it. It's this intermittent sort of thing, which makes it a little challenging. But I'll brainstorm on that, and when we get on the one-on-one, I'll have a couple of more solutions in mind. Okay.
Sure. Thank you.
All right. Thanks for joining.
So hey, Jeff.
Yes, ma'am.
It's the butt in person, but his pain sounds just like the pain I got over not too long ago. And I had it for years. And it got worse with standing, and doing a lot of things like that. But I have gone to physical therapy more times than I've been in the hospital, which is like 10 to 1 or something like that. Physical therapy really helped me. And then when I started using the patches and the physical therapy, and it was mostly for my low back, it really changed it because I wore the X39 and X49. And man, I became a moving machine and got stronger. And then the pain went away. It did. And I think I was in good control for some time. And then I had this extra push that I did with a machine, which is actually what hurt my hip. And so that's what's got me aggravated now. So I don't think I'm as strong as I think I am. I'm 85. I do get around well, but things get messed up pretty easy. So sorry to take so long, but it was such a similar situation. I certainly hope that he might have insurance. He maybe could go to physical therapy. I mean, I know we're a patching community, but we do have augmenting therapies that can help us. So that's just my suggestion.
Well, thank you. But his insurance, when he switched, it doesn't cover some of the things like we would use. So yeah, that's probably not an option, but
no, that's too bad. Okay, well, thanks for listening.
Thank you. Appreciate it.
All right, great input, Nancy. Thank you. All right, Stephanie, your turn. Go ahead and unmute yourself and ask your question.
Hi.
Hi.
I was wondering what protocol you would suggest for insomnia.
Great question. I personally love to use Eon and Alavita, those two patches together, and I put them right here on my forehead. Now, here's the caveat. A lot of people think, oh, I'm going to put on Silent Night, or I'm going to put on Eon, and it's going to knock me out. It's not really, it doesn't work that way. Silent Night is a great patch, and it works for a lot of people, but it raises your melatonin, which stabilizes your circadian rhythm and your sleep-wake cycle. All right, so that might take a couple, 3 nights, 4 nights for you to get into it. So just because it doesn't help the first night or the second night, doesn't mean it's not working. So that would be my suggestion, is you wear those 3 patches together and wear them, not quite when you're ready to go to bed, about like 8 p.m. and give yourself a couple of hours before you get ready to bed, however long that is. And then you wear it until you want to wake up or what have you. So 8 to 8 would be a good, or 9 to 9, or whatever you can, make a consistent schedule for yourself.
All right, thank you. But you said all 3 patches or just the 2? The
3. I would. So, well, tell me what's happening. Are you not getting to sleep? Are you not staying asleep?
Well, it's not me. My aunt, for the last 4 years, has only been able to get maybe 3 hours of sleep a night. So okay. She's barely functioning. Mm-hmm. So I wanted to try a protocol that you thought might help her get like a full night's sleep.
Okay, so I'm glad we had this extra discussion. So I think if she's just having challenges staying asleep or getting down at a decent hour, then I think Eon and Alavita, you got to stack them on top of each other. And then they go right here on the third eye. And then you wear Silent Night on the back of the neck at governing vessel 14. You can do that either or. You can wear Silent Night here and the stack on the back, or the stack here and the Silent Night on the back, okay? Now that's if this is truly a sleep-related issue. A lot of the times people say, I can't sleep or I have insomnia, when in actuality, there's an emotional component and there's some level of depression or what have you. That's one of the main symptoms of being unhappy and emotionally unhealthy, is that you can't get good rest, you can't get good sleep. And so sometimes that also goes hand in hand with some level of anxiety. So if there was some sort of event, some sort of stressor, something like that happened that created this challenge, then I might go a little different direction. I might do Nirvana and Eon. And you wear the Nirvana during the day, you wear the Eon at night, and just help kind of calm and relax your emotions, calm and relax your nervous system, And that way you can find yourself in a position to be rested and to rest. Let your mind be free and kind of get into the state of mind where you can go to sleep and relax. So I'm not sure which area she's in more or the other.
Great. Thank you so much.
Welcome. All right, guys. I got about 10 after the hour. If there are no more questions, I will let you guys go until next week. If you got a question, go ahead and raise your hand or unmute yourself and let me know. All right, going once, going twice, going 3 times, sold. All right, guys. Listen, the countdown has begun. I can't believe it. I just looked at the calendar today. I will be in the Philippines this time in 2 weeks. I cannot believe it. I'm so excited about it. I cannot wait. This is going to be my first time in Asia. I am a travel junkie, if you guys didn't know that. So I can't believe I'm getting a new stamp on my passport. I am ready to engage the Filipino community and learn all about their culture. I can't wait to eat. I can't wait to go on the beach. I can't wait to go hang out and see everything there is to see in the Philippines. So if you have anybody that you know that's in the Philippines, a couple of my team members are on right now. So this does not apply to you. If you have anybody there who may not know that I'm coming, may not know that we're going to be having several Lifewave events in several different cities in the Philippines, please let them know. Please have them contact me. It would be great to meet them in person and to discuss about how awesome this expansion into the Philippines is going to be. So I'm really, really excited about that. We're going to be doing our Patches and Prayer Symposium from Ilo City on July 30th. It's going to be, we're going to be broadcasting the event. You'll be able to join us for a small fee because we're having to get all of that set up. It is costing us, but it will not, I believe it's like $5 or $6 American. Don't fret, just take care of that. Help to support all of the stuff that's going on. We will be getting that information out to you because we'll have another Ask Dr. Jeff next week, revving up to the actual trip. So we won't be doing one while I get there. I'll be recovering from my trip and getting ready for all of the festivities. So we will start up Ask Dr. Jeff again when I get back, and we will keep the ball rolling. Please subscribe to my YouTube channel. All of the videos thus far are archived. In the title, you'll see what today's discussion is about, or what the previous lecture or conversation is about in the previous episodes. So it'll say, Ask Dr. Jeff, episode number so-and-so, and then it will say anti-cancer and homeostatic balance and carnosine, for example. That's what we discussed today. All right. So I bid you guys adieu. Happy Tuesday. And I hope that the rest of your week goes extremely well. I will see you next week.
Thank you.
Bye-bye.
Bye.
Bye. Bye, Dr. Jeff.